Hi everybody, and welcome to my video on the risk of infection through chemotherapy treatment. I thought it was quite topical right now and probably worth bringing forward and doing now, just based on recent headlines about the coronavirus. I'm going to start with the general information around the risk of infection, and then I will talk about what I'm currently doing because I am self-isolating right now because of the coronavirus. So the first thing to note, I suppose, that through breast cancer treatment, you have numerous treatments that will have an effect on your immunity, from surgery to chemo to radiotherapy. But chemo is probably the one treatment that will have the biggest impact on your immune system. Once you start chemo treatment, you will find that you will hit a low point in your immunity from about day 7 following chemotherapy to about day 14. And in that 7 days, your white blood cells will be at their lowest. What tends to happen, particularly on the FEC cycle, is that you will be given some injections called GCSF, and those injections can follow chemo more or less from the day after chemo for 3 to 5 to 7 days, depending on how low or how compromised your immunity is. These injections you do yourself, which does sound a little bit scary, but I can assure you that it isn't as bad as you may think. If you are really against doing it yourself, you can get a health visitor to come along at the same time every day and do it for you, or you can ask a close relative to do it. But it isn't quite as bad once you get going as you may think it is when you hear that that's what's going to happen. The injections are given, you give yourself the injections in your tummy, just under your belly button, and they are very painless to administer. However, there are some side effects to them, and that can range from joint pain, headaches, and sometimes you can get a pulsating cramp feeling in your back or in your lower back to the top of your bottom, really. And that pain is actually your bone marrow making more white blood cells. I found that I didn't suffer with any side effects initially. My injections were increased from 5 days to 7 days, and when they started to go up to those extra 2 days, I did start to find that I got a bit of discomfort on day 6 and 7. But what I did do is half an hour before I took the injection, I actually took some painkillers, paracetamol, and I did find they weren't as bad. You do keep the injections in the fridge, and it is a good idea to take them out half an hour before you give yourself the injection, because they are really cold if you forget. Make sure you've got plenty of antiseptic wipes as well, and you'll be given a little yellow disposable bin to put your injections in once you've done them. To check your white blood cells, you'll get a blood test that's on the week of your chemo treatment, and from those blood tests they will find what your white blood cell count is, and they refer to it as your neutrophil count. This can vary from 0, which means that you've got very, very low immunity, right up to about 8. And on the injections, when you're having the injections, it can go even higher than that. If your white blood cell count, if your neutrophil count is below 1.5, they may ask you to have another blood test. And most occasions, they won't do your chemo until your neutrophil count is at 1.5. I've had numerous issues with my neutrophils, and I think on every occasion it has been below 1. And actually, before I even began my treatment, my neutrophil count was 1.4. So a sleepy bone marrow. So there are lots of people like that. It is quite common, but it's just something to be aware of that treatment can get cancelled if your neutrophil count isn't high enough. So what happens if you do start to feel a little bit poorly? And I think the thing you have got to get into the habit of doing is taking your temperature. And you should be taking your temperature in the morning and at night, at least twice a day, and get into the habit of doing that. It's a good idea to buy a good thermometer from Boots. One that goes in your ear are the best and the most accurate. What you're looking for is to make sure that your temperature is above 35 and below 37.5. That is a normal temperature. If it goes below 35 or over 37.5, then you are, that means something's occurring. You will also probably find that if you're starting to see your temperature go up, that you're not feeling very well generally anyway. You may feel that you've got a sore throat, that you're feeling a bit shivery, that you've got a cold or a cough. And these are all signs that you have probably got an infection. Once you have identified that your temperature is not good, you then need to call the emergency telephone. So you will be given a pack that looks a bit like this. This is your emergency just in case pack, and within this is all the information you need to call the hospital if you feel unwell and your temperature has increased or decreased. It also has got a card that looks a bit like that, and in there is all of the information that you need to take into the hospital. It also has got the emergency telephone number in there. There is information in here for the doctor that you meet at the hospital to let them know what treatment to give you, particularly in terms of antibiotics. The important thing around feeling unwell and doing something about it is the possibility that you could have neutropenic sepsis, which means that your neutrophils have dropped so low that they are struggling to fight that infection. And that is very serious, and you do need to do something about it quite quickly. So when you call that emergency number, what will happen is that you will be, of course, directed to a nurse, and they will assess you over the telephone. I have been in this situation. What then happened was the nurse spoke to the local hospital, then called me back and told me to make my way to A&E and bring with me the red card. Once in A&E, I made myself known, and they very quickly moved me out of the waiting room, because that's really important, because you don't want to pick up any further infection, to a room where you're on your own. And there you will be assessed. So they will immediately give you the antibiotics that are prescribed in your pack, and also start to look at where the source of the infection is. And they'll give you a number of tests. They'll test your blood, they'll test your wee, they'll probably give you a chest x-ray, and all of these things are then collected together and given to a consultant. You will find very likely that you're there a long time as normal. It doesn't really mean you're quicker because you are a cancer patient. And also I would just be very aware of the lots of different types of consultants within A&E and doctors. I am not an expert, but there may not be somebody that is a cancer expert. And so it is important that you go with a certain amount of knowledge, particularly, around the care of your PICC line. You really want to make sure that only people that are trained in using PICC lines are using your PICC line. I was very lucky when I went in, because there was a chemo nurse on duty, and she looked after me. But it is just go in with enough knowledge to make sure that you're giving everybody the important information, and that you're checking that they are listening to you. So the key is take your temperature twice a day. Any changes in how you're feeling or your temperature, call the emergency number. Protecting yourself from infection. So there's many things that you can do. Now, the biggest thing, I suppose, from my perspective is when I spoke to the chemo nurses about this, they were very insistent to say, be cautious, but don't stop living your life. And I feel that is really important, because you are told that if you get an infection, it could be serious, and it is something to take very seriously. However, you really do need to try and carry on as much as you can as normal. And for me, that has meant continuing to go to restaurants, to go to the cinema, to go and see a show, but being very wary of where I sit. If I hear somebody coughing or sneezing, moving away, wearing gloves, particularly in supermarkets with trolleys, making sure that I'm protecting my hands and washing my hands more than ever, and also not going on public transport. And you know, you can carry on working as well. You've just, again, got to practice a bit of caution. So for me, in my circumstances, I am a trainer and a coach. I do a lot of training in people's companies, in a company venue, surrounded by lots of people. Usually I will have a group of about 12 people. I decided that was too risky to do, because I couldn't guarantee that the people that I was training would not have something that I could catch, particularly being very low in terms of my immunity. But I could still do coaching over Skype, particularly one-to-one coaching. So I continue to do that. And I also looked at ways in which I can do virtual training and facilitation. So I have done a few things like that too. So it's about looking at the work that you do, what do you need to change about that work to make it safe, and who do you need to talk to in your business to help you do food preparation. And again, it is quite common sense what you need to consider. To be honest, it reminded me of when I was pregnant and some of the restrictions that are put on your diet when you're pregnant. So you don't want anything that's going to contain any harmful bacteria. So it's all about those soft cheeses, pâtés. It's all about eggs not being cooked correctly. It's all about washing your fruit and your vegetables. And there's lots of information that they provide you. They will give you a leaflet about food hygiene, they will give you one about infection, and they'll also give you one about keeping hydrated. Really important to keep drinking water, particularly if you're not feeling very well. It's good to keep your mouth moist, and that's healthy. It's also important that your kidneys are being sort of flushed through with water on a regular basis, because it's those areas of your body where bacteria will start to grow. Your mouth, that's another area that can get infected. You do seem to struggle a lot with ulcers. That is evidence that your immune system is low. So go to your oncologist and get a prescription for an antiseptic mouthwash. I've used that from the very beginning and had very little trouble. So finally, really just bringing us back up to date with the coronavirus, and what I'm doing currently, knowing that my immunity, so my neutrophils today are at a very low level of 0.6, and I decided beginning of this week to self-isolate, and a few days following that decided that it was safer if the children stopped going to school. It's interesting now because they're not going to be going to school from Friday, but they've been at home with me also self-isolating. And then with David, who goes out to work every day, what we're doing is when he comes back home at night, he is putting his clothes straight into the washing machine. He leaves his shoes outside and he goes and has a hot bath or shower just to make sure that he is free of infection. We are socially distancing ourselves at home. We are still watching TV in the same room, but we are separated. We're not sitting together. I am sleeping in another bedroom now from my husband, and we're making sure that on a daily routine, we are disinfecting the house. Everywhere that hands are going, remote controls, telephones, laptops, light switches, door handles are getting extra treatment, but we are trying to practice some really good housekeeping at the moment as well. If and when, I suppose, David gets the virus, we are planning at the moment a contingency plan for that event, and it will likely be that I will stay in the spare room for 2 weeks and quarantine myself within there, and when I do leave that room, maybe to come down and prepare food, they will make themselves scarce, but we can see that being a sort of 14-day thing. That's what we're doing right now. We have also got a sign on the door saying, please beware, there is a vulnerable person here. If you feel unwell or somebody doesn't answer the door, then it's because of that. So we'll also put that measure in. So worrying times, there's a lot in the news to stress us out a little bit. So so there might be further videos that I'll put out about sort of keeping yourself busy and your mental health around this particularly worrying time. But for now, that's the end of today's video. Thanks for watching and stay safe.